Hi, it's Tiffany.
And this is Mike from How I Med.
So today we are going to be interviewing Kelly. She used to be a pediatric ambulatory nurse prior to all the COVID patients coming to her New York City hospital. So right now she is mandated to work in the COVID floor. So we have some questions that we have for her, and we would like her to kind of elaborate her experience as a new as a new COVID floor nurse.
So Kelly, how's your hospital like with this whole COVID experience?
Well, first of all, I just want to say thank you for having me. It's been a lot. It's been very stressful. I work with OR nurses and PACU nurses who don't have some experience working on the floor. So it's just us trying to figure it out one step at a time and each day.
And so in the hospital, like, do you have any issues with PPEs? Like, how has it been in regards to the actual life, like in the hospital as a nurse? Like, I know that you worked in pediatric ambulatory before, and now you're working as a COVID floor nurse. So how has that change been, like in regards to equipment, or in regards to the pediatrics to adult, in regards to the team, in regards to like even management? Like, how has it been for you?
How has it been? It's honestly been very difficult because the unit I work in was closed and they just opened it up for COVID patients. And a lot of us weren't oriented on the floor. We don't know where the supplies are. And with PPE, it's, as you know, there's a shortage. So now they want us to reuse the gowns for each patient. But I find that very, dangerous, because when we walk out the room, we have there's a potential of spreading that the spreading COVID to like our coworkers as well. So it's just like, how can we protect ourselves in the process, but also be there for patients? And we're nurses, and a lot of us do want to help, but it's hard when we don't have proper protection, and a lot of us just don't have the orientation. We were just thrown into these floors and expected to just go with it. And a lot of us don't have floor experience. Like me, I don't work with adults, I work with kids. So just like figuring it all out. But my coworkers have been so supportive, and management have been listening, but there's only so much they can do. So we're all just trying our best, but yeah.
I also want to bring up that previously recording here, we kind of had a talk that your hospital is kind of telling you, or like kind of assigning you to ICU patients now, which obviously you're not comfortable with. Like, first of all, you're not working in the same population that you used to, and now you're working with not ambulatory, not floor, but now ICU patients. Like, how have you been dealing with that?
Honestly, I do not accept the assignment because I find that really dangerous and very unfair. When I care for my patients, I honestly think of like, okay, how would I feel if this was my family member, and to have a pediatric nurse with no adult experience, and especially like no ICU experience, I don't feel comfortable taking care of them. And I want them to get the best care. And families put so much trust, put so much trust in like doctors and nurses. And in the end, like, it's someone's life. You can't really take that lightly. So I bring that to the managers, and I explain to them, like, I understand it's heavy right now, but like, for me to have that patient, I'm not going to accept it. And luckily, I haven't been getting any setbacks, and they've been understanding. But it's a lot of like really standing up for yourself, because no one will. So I advise all nurses to just really speak up when you feel uncomfortable caring for a certain patient.
That's awesome. And how have you been coping with all this? COVID-19 is really stressful for all the nurses across New York City and across the country. What tips do you have for our listeners that you do outside of work that helps you get through the day?
What do I do? Sleep. No, I rest. I listen to my body and really try to take care of myself. And if that means pushing myself out of my bed to make sure I eat properly, and making sure I nourish myself, whether that's like eating healthy foods, because to really prevent getting COVID, you have to build your immunity. So taking my vitamins, trying to get some exercises, whether it's stretching, it doesn't have to be so strenuous. And most importantly, I know it sounds like tacky to some, or like to people who don't believe in anything, but really prayer and like spirituality, just really, getting in touch with myself and praying, and like trusting and not letting me sink in that hole of like despair and like thinking that things aren't going to get better. Because as much as, you know, we need to work, it's very important to protect our minds. You know, it's not a time for us to be losing our minds. So find out what makes you happy. Like if you don't believe in anything or want to pray, you know, do some self-affirmations, you know, saying that you got this, that you're protected. Just even like reinforcing and saying to yourself that I'm protected, to me has been very helpful. And I use my crystals, you know, I use my herbs. I've been taking ginger every single day, and thyme and oregano. And you know, I'm very intentional, so when I drink my tea or my food, like I really communicate with it and like ask for like protection from it. So I guess it's just, you know, being more sensitive and intentional with things, and trusting. Mainly it's just trusting in something bigger than myself, that I'm okay. Yeah.
I really like what you said. It's nice because you really don't talk about any negativity around COVID. Because even when you look at the news, if you go on social media, it's always negative and always kind of, you're going to get sick. It's like automatic. But like the way that you are addressing it and the way that I'm trying to address it too is just to build my immunity. And it's really hard for people to stay positive if they're surrounding themselves with negativity. So I really like the advice that you gave, because I didn't even know the oregano and thyme. I mean, I cook with it all the time, but that's great that I'm helping myself.
Yes, there's like so many foods out there that you can get at your local supermarket that's antiviral: thyme, oregano, ginger, and boiling that with lemon and orange peels, having oranges every day. And one thing I forgot to mention that's like super important that has helped me cope is really finding your support system and asking for help. Like nurses, we cannot take on the stress ourselves. You know, we need to we need to communicate our feelings, find that outlet, whether it's creating, but like talking, you know, we need to talk our feelings out. Don't be ashamed. You know, we're always so used to caring for others that sometimes it's okay to be taken care of too. So, you know, reach out to your loved ones, let them know how it is, how stressful it is been for us and for you, and, you know, find your support and your community. And it's
I love that.
Yeah.
Oh, that's Kelly, that's great.
Part of the reason we're doing this, you know.
Yeah.
He's trying to get
now.
yeah, we're trying to get nurses to really like express themselves and really talk their feelings out with family members, friends, even your own coworkers. Because I mean, I've had times where I was really heartbroken from certain situations, and the best way to, you know, get through that hurdle is just talking about your feelings.
Yeah, for sure. But I really hope that everyone stays safe, especially at this time. We know that it looks like it's plateauing, but we need to keep the social distance. And I just hope that everyone stays safe and build their immunity. And thank you for coming onto the show. We really appreciate that you came and took your time to answer some questions.
Thank you, Kelly.
Yeah, no problem. Have a great night, guys.
Bye.